To some health news, a deadly illness that is spread by the tsetse fly could soon be eliminated as a public health threat. Sleeping sickness is a lethal disease and has killed hundreds of thousands of people across several African countries over the past century. And the parasite still persists in remote parts of sub-Saharan Africa. But a new drug developed by DNDi and Sanofi could help halt the spread. To discuss this further, we can bring in Dr. Luis Pizarro, the executive director of DNDi. Dr. Pizarro, welcome to the program.
Hello, thank you for inviting us today.
Now, Doctor, I want to start and ask you, how big a threat is sleeping sickness to public health?
Sleeping sickness has been a horrible disease through the last century. Thousands and thousands of people have died from sleeping sickness. Thanks to the work, our colleagues are doing today in countries like Congo or Guinea, fortunately, almost between 500 and 1,000 people are being infected by sleeping sickness today. So we are improving the situation, but it's still a deadly disease, and this is why we're so happy today to be able to bring with this new drug.
Now, as you just mentioned, your company did help to develop this new treatment. It's, as I understand, just a single dose. Can you tell us how it works?
Yes, in the past, the drugs that were used to cure sleeping sickness were horrible drugs. Some of them were done with arsenic and could even kill the patient. Then we were able to improve this and bring safe drugs, but that were very complex in terms of logistic. And as you know, maybe sleeping sickness is affecting people in very remote areas. So we needed something very simple that will be heat stable, easy to give to patients, and without hospitalization. So now acoziborole, it's a tablet. You take one dose and you are cured for all the stages of the disease. So it's really a revolution in the interest of the patients.
Now, you mentioned there are a couple of the other treatments. I was also reading about that one with arsenic that did sound truly horrible. So if we're looking at your new drug, how effective is it? How does it stack up to previous treatments?
This is also why it is a revolution, because it's going to cure all the stages of the disease. At the moment, it has been validated for adults, and let's say children that are under 12 years old and more than 40 kilograms. But we are now in parallel conducting clinical trials in Congo today to be able to prove that this drug is also safe for children. So that's going to be the next step. It's not only with this drug cure all the adult patients, but being able to propose this also for children.
Now, I understand, Doctor, that if the sleeping sickness is left untreated, it's almost always fatal. So with this new drug that's coming out, that's just been developed, how many lives do you think can be saved?
If we think that today, let's say almost between, as I said, 500, 1,000 people are infected by the parasite every year, and if we want to go to elimination of this disease in Africa, I think it's very important to show that this drug is not going to cure only the 500 or 1,000 people that are infected, but this drug will contribute to the public health approach we're putting in place, of course, with Sanofi, who is developing this drug with us, but also with the World Health Organization and all the ministries of health in the countries that are affected. Our intention is to save lives, but also to eliminate the disease in Africa. So make that, those countries that are sometimes in very fragile situations will not have to fight, as they are doing today, against the disease.
Now, as you were mentioning, it's still out there. Sleeping sickness is still out there. There are these other treatments working to help people get better. But why has it been so hard to eradicate this disease?
I think this is a very important message I would like to deliver today, because we have seen in now that, so difficult and bad news around us all the time. And we see that if we are able here to bring different partners. We talked about Sanofi and WHO, but also ministers of health, foundations, research colleagues that have decided to work on this. It's possible to address a disease that was not interesting, the classical R&D, research and development system, that most of the time is driven by profit, by the interest, right, to make profit, financial profit. And here, those patients, well, they live, as I said, in very remote areas. They are sometimes in very poor conditions. So they are not the main objective of the traditional research and development model. So what we have shown here is that if we decide to work all together, it's possible to have an alternative model and address the patient needs. And this is the real mission of DNDi.
And one final question for you. I understand that this was once studied for cancer treatment. Now the European Medicines Agency has just given it a positive opinion. So what happens next?
Yeah, it was very important for us to really prioritize the access of this drug as soon as possible for the patients. So the European agency gave the green light. Now the World Health Organization is going to include this drug into their guidelines. Every country will include this drug in the national guidelines. Sanofi will offer the drug to WHO that will make this drug available for all the patients in each country that it's affected today by sleeping sickness. So in the next months, all the countries affected by sleeping sickness will be able to propose this for everyone who is infected.
Dr. Luis Pizarro, thank you so much for speaking with us today, sharing your expertise. That's the Executive Director of DNDi.